So how do I know if I'm a good candidate for LASIK? Well, for starters, most people are, but there are a few things you need to know. First of all, a reason not to have a procedure is called a contraindication. And in LASIK, there are some absolute contraindications. If you have these, don't have anything done. One, if you have keratoconus. Keratoconus is an abnormally thin cornea, and the cornea loses its shape. I have keratoconus. If you have it, you won't have LASIK. Two, if you have a herpes infection in the eye, and I know this sounds awful, but herpes simplex is the cold sore virus, and people frequently get this in the eye. The other herpes virus is herpes zoster. Zoster is shingles. So cold sores and shingles in the eye are actually very common. We see that a lot. If you have that, don't have laser vision correction. The next thing is you have to pass our corneal mapping. We have some very sophisticated devices that will map your cornea. And what we're looking for is corneal thickness. Do you have enough cornea for us to do this? Corneal shape and corneal integrity. And we can assess all of this. If you pass all of our mapping, we're not worried about your cornea. If you don't pass it, what would we be worried about? Well, when we do this, we're going to make your cornea thinner. How thin is too thin? We don't want to make your cornea too thin. If you pass the mapping, there's a less than 1 in 10,000 chance we're going to have a problem.